Today, I'm Isa Baza and I'm here at the Guam Memorial Hospital to find out an update about the TB response effort that has been going on here for several weeks. So, can you both introduce just for the record your name and title?
Sure. My name is Dr. Kozeshmabukra. I'm a pediatric ICU doctor by training, but I currently work for GMH as an assistant director of medical services.
And my name is Philip Talboy. I'm the senior advisor to the director of the Division of Tuberculosis Elimination at CDC. I previously was the deputy director of the division for about 11 years.
All right, well, thanks so much for sitting down with us. We just finished up some presentations regarding treatment of TB diagnosis. And so can you tell us a little bit, Dr. Koze, about the response effort that happened here at GMH?
Yes, I think that all the island has been informed initially when the case emerged, and there was an index case meaning the person who was suspected or confirmed the TB was identified to be one of our employees, and that unfortunately the people who may have been exposed to the index case happened to be a newborn babies. So as soon as we have discovered that we have called a mass response, I can't see it any better the way it was a massive, huge response together with the public health, GMH, and also with the community physicians, pediatric physicians, and also radiologists and whatnot to decide how are we going to see this baby, and to just given how much of big scale there was a 317 babies who were exposed, we identified as an exposure, and also including their parents. So you can imagine how many people we have to see. Usually when the cases like this happen in the United States, that we hand this kind of case over to public health, because this TB is a public threat. It is a life-threatening disease. It's easily spread, as we have just learned in the lectures that it happened a few minutes ago. So it is a public threat, and in other states, and the federal government encourages the public health to deal with this. But obviously, this scale of exposure, you cannot just put it into one agency's shoulder and say, you take care of it. And so we got together, public health, GMH, and everybody got together, pharmacists and radiologists got together, and we came up with a plan to have an ad hoc GMH screening clinic at the ER annex here at GMH. And just to given how amazing this response was, I do work for GMH, but as you know that I also am a professor, assistant professor of pediatrics at the Children's University, and I respond to disasters and things like this quite often. And the response time that since they have identified and put their clinic together was only 2.5 days. And I have never seen, I think you can agree, that yes, I have never seen such a quick, swift, and critical response that I have seen by this community together with public health and GMH. There was 14 physicians that volunteered without a pay. They came in day and night and saw these babies, and the parents and the nurses and security guard. Everybody was here to help, and public health employee came also to triage, and it was really impressive. I'm proud of community of Guam to be able to have such an interagency collaboration. Wouldn't you say?
Yes, and due to the nature of TB, because it's an airborne infection, we see outbreaks in hospital settings and staff and employees with patients and drivers and security guards and all that. So it's not an uncommon thing to have an exposure in a hospital. What is remarkable, as Dr. Koze said, is the rapid response and the community coming together and the collaboration between GMH, the public health, as well as the medical community within Guam itself. It was highly remarkable and very quick and speedy.
And I know one of the biggest challenges with this response was just contacting the babies and the families, and so there were some telephone numbers that weren't working, and so I know that mail was mailed out to inform these individuals that they should be screened. So how has the screening been? How many babies and families have been screened so far?
Yeah, that's also very, very successful in my eyes. So there was 317 babies, as I mentioned earlier, that was exposed, and out of that, 227 babies were screened. That's so roughly about 75% of the patients were screened in such a short amount of time, 2 weeks really, and together with 112 adults. So with the screening, I am happy to give you this update. There is a zero disease, so that means everybody was negative so far with the X-ray. And so now we are waiting for the tuberculosis skin test for these babies to come back. The difficulty part was really, again, a challenge of Guam. So as you know, GMH, 73% of the patients here is under poverty line, and then some of them are homeless, believe it or not. And we have a difficult time contacting these people. They don't have working phone lines, they can afford cell phone, they don't have landlines. So 90 patients, 90 babies are still out there without being able to be phone contacted. So that's when public health stepped into, and then they identified the physical address of these babies as much as possible, and then mailed out the emails, hey, you know, you are one of those babies, please do contact us. So we sent out that email too. So we have a first layer, second layer, third layers of way to reaching out to these people. So.
Okay, so and one of the big announcements today is that the treatment that has been going on here at GMH will now be moving to public health. Is that correct?
Right. So I don't want any confusions in the public of what's going on. So what's going to happen from now on? So September 13, our last day of ad hoc clinic at GMH. So it's going to be the directions and the leadership is going to be handed over to the public health. And since they have already worked on the logistics and how to deal with this massive amount of people and the babies and whatnot, so what they're doing is that they are referring the patients to the Northern Community Public Health, and screening and also the follow-ups and dispensing of the medication will be done at the Northern Community Public Health.
Okay, and so one of the things that this situation brought to light was just TB in Guam, and so I was looking at your presentation. It seems like Guam has a higher rate of TB than other parts of the United States and Hawaii, and also we do have multi-drug-resistant tuberculosis here, which is an issue because it's so expensive to treat. Can you tell us a little bit more about what impact this could have on our island?
Correct. What multi-drug-resistant TB is it's resistant to our first-line drugs, our two first-line drugs, isoniazid and rifampin. So what we have to do is go to second-line drugs. Some of them are injectable. So it is a much more costly treatment because you have to have a nurse or a visiting nurse or a hospital actually do the injections. And then our health department employees go out and do the directly observed therapy where they actually watch the individual take the pills and make sure that they take their pills and then check them for any side effects. So it is much more costly than regular TB. Some of the statistics show it could be up to $250,000, between $125,000 and $250,000 to treat an MDR case. So that's why it's really important to get the regimens right, to observe the patient, take the medication, and patients have to take the medication from the start to the end of the treatment regimen. Otherwise, you develop the resistance.
Is there anything else you'd like to add about MDR or MD?
Yeah, I think, you know, after being educated briefly with the webinar earlier, you know, that Guam has a 16 times more prevalence of TB than anywhere in the U.S. And that's frightening, isn't it? Because TB, because we have it so common here that I feel like Guamanians have learned to put it on the back burners. But, you know, for me, the newcomers, this is something really serious. This is that's the reason why we took this seriously when there was a possible exposure to the babies, because, you know, when TB is, remember, this still is a life-threatening disease if the immunocompromised patients catches it or the young ones catches it. So, you know, this is a tip of the iceberg, as you have stated, and we gotta get control on this. And I think that Guam needs more support, the public understanding, and the public health needs more support to control this disease. it's unthinkable to think that, you know, I'm exposing my family and my baby every day to a risk of catching this disease. So I think that now that there is emergence of MDR. In fact, actually, you were sent to here because of the MDR initially, because CDC is taking this emergence of MDR so seriously. Mr. Phil actually was sent over to address that issue and assess the area to see what we can do to stop this spread. So we are lucky that we had expertise during this time and in his guidance. But you know, I would like the people of Guam to know this is a serious thing, and we as a community, just as we did this time, we as a community physicians and community of Guam, that we should take this seriously and support the program. So.
Okay, thank you so much. Is there anything else like that?
No, that's it. Oh, I do have one thing. I'm sorry. One more important thing. So I know that I have been getting a lot of phone calls from the families that, you know, my babies after start taking this medication, as soon as that they have vomiting, their appetite's down. So without talking to the doctor, they just stop the medication. I urge you not to do that. I know it's difficult to see your baby have diarrhea and whatnot, you know, and but please do let us know first. Let us know, mean that the public health physicians and TB program know, so we can address that to decrease the side effect, and we have a tricks and whatnot to help you with that. It's very important for them to continue the therapy until your baby is 6 months of age, because again, I have a baby too. If this exposure may not be, you know, like your X-ray is negative and your exposure risk may be low and whatnot, whatever the reason is. But if there's a 1% chance of my baby getting the tuberculosis, I will prevent it. And that medication, isoniazid, will do just that for you. You know, so take it. If you have questions, concerns, contact the doctor. Don't try to stop it on your own without talking to a medical professional. That's it.
And I would just like to say, as you saw from the presentation, that TB is an airborne disease, but it's people sharing air and a lot of air together in a small space without a good ventilation. Walking down the street, walking next to somebody with TB, the likelihood is almost zero that you could catch that. We see in the households of people that are infected, where they are sharing the same air, 20 to 50% of those people are infected. The other 80 or 50 to 80% don't even become infected. So it's, even though it's airborne, you have to share a lot of the same air as the individual as they're coughing.
All right, well, thanks so much for joining us. We'll have more on this story tonight on KUAM.